Hi, I'm Dr. Fauley at Care Animal Clinic, and I'm going to talk about dog exams and the wellness exams that we recommend doing once a year. This is my dog Harley. He's 6 years old, a golden retriever. We just vaccinate him once a year. Of course, I live with him, so I know if there's an issue, I can notice it right away. But for people who have their dogs and they've only seen, we recommend seeing them once a year just for the regular wellness exams. It starts out as puppies, obviously. Everybody starts out with a puppy, and well, usually. But we start with puppy vaccinations, and those are important to get. We start them about 7 to 8 weeks old, and you go every 3 weeks until they turn 16 weeks old. So at 4 months, you finish the vaccinations. You get their last distemper, and they get rabies, and that's when they get their tag and their certificate, and those types of things. So the vaccinations that are typically done, these are just some examples. This is a distemper, that's an optional Bordetella, Lyme vaccine, rabies. The ones that most people get are going to be the distemper combination and the rabies, because that's the one that's required by law to that's when you need your tag and certificate. Other dogs who are at risk for, if they go camping and they're at risk for ticks, ticks can transmit Lyme disease, so you can vaccinate them for Lyme disease. Bordetella is an optional vaccine that dogs get if they go to the kennel, many kennels, or puppy schools, especially as puppies. If you go to a puppy school, they're going to request or require you to have a Bordetella vaccination. So those are the vaccinations. They start at, like I said, about 2 months old, and they're finished at about 4 months old. Then from that point on, it's just once a year. And at the once a year visit, rabies is given, the distemper is given, any optional vaccines that are given, and also that's when you do your heartworm test and a fecal test is done. Those are the typical combination of things that are done on a yearly basis. A wellness exam is, well, that's an exam as part of the vaccinations, but that's the very important part of it too, because you're able to evaluate things, the veterinarian's able to evaluate things that the owners might not notice at home. We will do things like, I always start at the top of the head, and one of the first things that you look at is the eyes, and we use what's called an ophthalmoscope, okay, so you're able to check the retinas, check the status, make sure that there's not some sort of inflammation or infection. So we just check the eyes. Then you also check the teeth, okay, make sure that the teeth are clean, healthy, and that there is no excessive tartar buildup or that there's any damaged teeth. Ears are a big problem with dogs. They can have they can have ear mites, ear infections, and so we use a scope. It's on a TV. It's a TV monitor, and it's a video scope that looks down in the ear canal, that we're able to see it on the TV, and the owner is able to appreciate things very well because they can see everything that we're seeing. And so the things that we'll look for, like I said, sometimes you have polyps, sometimes there's bacteria, sometimes there's yeast, and a lot of times you have little insects. Those are called mites that are crawling around that cause the dogs a lot of scratching. So if you notice your dog scratching at his ears, that's probably one of the first things to look at. We check the coat. You want to look for fleas, you want to look for skin infections that are kind of typically called hot spots, any thinning of the hair coat, which could be metabolic problems like thyroid issues or something like that. You check the heart. This is just a stethoscope that's always used to make sure that the heart sounds like it's a normal beat and a normal sound, so there's no arrhythmias or murmurs. We check the limbs, make sure, especially with bigger dogs, they can have problems with hip dysplasia. It seems like each breed has their particular concerns that we want to look for. And then after we're done, it probably takes about 15 minutes to go over everything. By that time we have the heartworm test results back, we've done the vaccinations. If everything looks okay, then they go home and then they'll get a reminder a year later. That's what keeps them in good health. We talk about things like behavioral issues, the food, what type of diet that they might be on, their weight. We'll check. We'll look at that, and if there's issues with that, then we'll maybe discuss some ways to address that. So these are the types of things that are done, and it's a good thing to do once a year, just to make sure, since our pets, our dogs can't talk to us, that then they just come in here and we're able to check these things out for them.